Long term, however, I think the strategic success is going to be determined by whether or not we can successfully introduce interprofessional education. I was heartened, I must say, when I heard what was going on here today. These projects that are occurring in all of the various towns, and there's 15,000, 20,000 people in these towns, but they have the wherewithal. That's the forward edge of the battle area for healthcare in northwestern Ontario. It is in downtown Toronto too. The people that are working there want to work in teams. They want to improve the care and the outcomes. They want to engage with the patients and physicians. They need a few other tools, the epidemiologic tools, the numeric science tools, perhaps some environmental science tools that are more in the mode 1 area of knowledge production, and hence there is a role for everybody in this, particularly people in academia like at Lakehead or U of T or McMaster or any other university which have some of these skills to help the people. I think places like Dryden provide a substrate for the education to occur so that this training, interprofessional training, could and it should be started in undergraduate environments where people in first semester or first year of these schools should be involved in learning the theory and the evidence for, and at least case study practice of working with teams, so that they don't have to grow up and become a middle-aged cardiologist before they discover it. And the bottom line is always to communicate. I've told you General Schwarzkopf's definition of leadership. Other definitions of leadership focus on communication, and I think that is not to be frowned upon. That's what's happening here today. That's what excited me from what I heard this morning and this afternoon. But in particular, I think we have to have a system that allows us to get those clinical measures in the electronic medical record. Now, between when I agreed to come up here and before I actually got here, look what I read in the New York Times. Walmart's going to give us the electronic health record. I don't know about northwestern Ontario, but you cannot live in Montreal more than 1,000 meters from a Walmart. People are going to run out. But look at the cost that they're talking about. It's part of this stimulus package, Obama's stimulus package, $19 billion. It turns out that Walmart's been working on this for about 3 years. They've got 30 clinics. I didn't know they had a health section. They've been piloting this in 30 clinics, and their partners are Dell Computers and eClinicalWorks, which is a software company. But this is one-stop shopping. Proportionately, Canada may have spent more money on this already. You know, we have the Canada Health Infoway, and I know from talking to my former colleagues in Alberta, they've had difficulties getting a workable electronic medical. I think if you buy a flat screen TV at Walmart, it works. I have a feeling that this may end up working as well. I hope that we are, shall I say, liberal enough or outgoing enough or smart enough to, if this works, then take some of our existing resources and because this is what, when I talk to the people that have tried it, this is what's missing. A reliable purveyor who's not going to go bankrupt tomorrow or walk away from the contract after the people in the clinic have spent $200,000 in 6 months trying to get it done. This is a reasonable price. Whether it will carry over to Canada or not, I don't know. This Dr. David Brailer had he's quoted in the article by this journalist. He had a high position in the former Bush administration, and this is what he says about what's going to become now an Obama administration, probably a success story. He says it could be a game changer. When I read about this, this was at the end of the article, but that's what I was thinking in my mind. when you start doing the kind of disease management that I've outlined for you and that I've been involved in, it comes down to two things. You make a partnership, you do measurements, and you communicate it. You can get into this Zen-like argument, what's more important, the partnership or the measurement? Partnerships are not easy. For those of us who have been married, you understand very well. However, partnerships can be done probably easier than the measurement piece in healthcare at the moment. It's really the sticking point because they require resources, human resources. This is very promising. We're running out of excuses not to do it if this happens. Close off now. In my former company, we used to sit around the executive table and we'd say, culture eats strategy every time. This is a quote from an internist at Harvard, Mark Bard, and he's saying the same thing. So I'm giving him credit for it, but it's not the first time I heard it. Let me leave you with a sense of optimism, however. Despite what I've said about the cultures and what I've shown you and about the apparent differences, the more I think about it, the cultures of Mode 1, Mode 2 knowledge production, town and gown, academia and health delivery operations, they're much more similar than dissimilar. This is how I see the values systems of the LHIN, perhaps on the left, or L'Agence Montréal on the left, and the people in Dryden or in Southwest Verdun on the right. You may think you're in a different place and in a different culture, but if you go through the value system that's driving you to do what you do every day at work, to me, maybe you're using different words for the same thing. The value systems are very, very close. And you're trying to do the most good for the most people at the best cost. If you do it, if you're successful, and I think a lot of you are going to see success, you can bet on getting improved care and outcomes just like they did in ICONS. There will be system efficiencies. I didn't show you the data, but it was measured in ICONS. I was telling Gwen about it earlier. Very big positive budget impact in Nova Scotia and in Canada, actually. There's a spillover of this because it's so service-oriented. There's a very big cost benefit of reducing readmission rates like that for major disease states as well. So you end up improving the wealth of the society in which you live and its productivity. And I think it will allow the practical manifestation of an integrated health policy, research, and operations, all of them working together. Because remember, there are more similarities than differences. So the mantra for people like me, and I believe now, for a lot of the people that live in the Northwest LHIN, things can be better. Thank you very much.